Hello, this is Dr. Manas Chakraborty. We will be talking about uterine cancer in a nutshell. We will discuss symptoms, causes, investigations, treatment, and prevention. Symptoms. Uterine cancer almost always presents with out of rhythm bleeding vaginally. If there is a bleeding after menopause, then it needs to be investigated all the time. Particularly beyond 40, out of rhythm bleeding or irregular bleeding needs to be investigated. Sometimes we see that there is a common tendency as if the bleeding is controlled, people sometimes think that the problem is gone. However, beyond 40, it is more important to diagnose why this bleeding problem is happening rather than treating it. Uterine cancer presents with abnormal vaginal discharge as well. Previously, it was thought that the uterine cancers are mostly happening in elderly women. But nowadays, in women or girls in 20s and 30s with irregular vaginal bleeding, sometimes we are finding uterine cancers. This is mostly associated with PCOS or polycystic ovarian syndrome. It is important to realize that not all polycystic ovarian syndrome patients will develop uterine cancer, but some will. It is important to keep a vigil on the problems. In most of the cases, with a bit of help, this can be avoided. Causes. Most of the uterine cancers are linked with obesity or being overweight. If someone has got diabetes or high blood pressure, they have got a higher tendency of developing uterine cancer. Sometimes uterine cancers are linked with genetic problems. Many of them may not be hereditary, but some of them will be. If in a family you have got problems with uterine cancers or colon cancer and everything, there will be a need to check uterine cancers if there is abnormal bleeding or sometimes without even that. Having a pregnancy protects against uterine cancer. That doesn't mean that who had a pregnancy will never develop uterine cancer, but tendency will be a little bit lesser. Investigations. Most of the investigations of suspected uterine cancer starts with an ultrasound scan, and this ultrasound scan needs to be a transvaginal ultrasound scan. If you want to know about transvaginal ultrasound scan, we'll link our YouTube video description somewhere where you can have a look. What is the difference between the transvaginal ultrasound scan, that means the vaginal ultrasound scan, that means the ultrasound pictures taken via vaginal route, or when the ultrasound picture is taken from top of the abdomen, which is called abdominal ultrasound. For suspicion of uterine cancers, vaginal ultrasound is most reliable. If there is a higher suspicion, sometimes we need to check the inside lining of the uterus via hysteroscopy. The old style so-called D&C procedure, that means the scraping out the inner lining of the uterus without looking at it, is mostly obsolete nowadays. Hence, checking of the inside lining of the uterus can confirm or rule out endometrial cancer. Once the uterine cancer is suspected and proven, sometimes we need an MRI scan or CT scan to check the spread of the disease, and so that the treatment can be adequately tailored or decorated around that information obtained from a CT or MRI scan. Treatment of the uterine cancer almost always starts with a surgery. Of course, if that is possible and if that is suitable for the patient. Every patient will have an individualized, personalized surgery and the extent of the surgery. In most of the cases, first we need to take out the origin of the cancer, that means the uterus, and in many cases there will be hidden cancer hiding in the ovaries, so ovaries may need to be removed as well. Apart from that, to check the spread of the cancer, sometimes the lymph nodes or the adjacent lymph nodes in the lower part of the abdomen of women may need to be removed. Depending on the type of the uterine cancer, sometimes omentectomy may be needed. Omentum is a fatty layer inside the abdomen of the women. Not the same fat that we see when we stand in front of the mirror, but this fatty layer stays inside the abdomen as an organ called omentum. After the surgery, once the biopsy reports come back and after checking how the patient has recovered from the surgery, there could be a need to further give radiation or rarely chemotherapy. Of course, who will need what? That will depend on the type or the subtype of the cancer, because there are many smaller sub-varieties of the uterine cancers are there. Based on international guidelines and protocols, the doctors will discuss with you regarding further management or any other treatment required beyond the surgery. Prevention. It is recommended that if you have got any abnormal, irregular, out of rhythm bleeding beyond 40, you should report it to a doctor. Apart from that, as the uterine cancer is mostly linked with obesity or being overweight, having a healthy lifestyle early in your life can help preventing uterine cancer developing later in your life. Regular exercise, good diet and healthy diet is always helpful in preventing uterine cancer. Needless to say, when the uterus cancer is familial, that means there is a genetic hereditary ring of the uterine cancer. In those cases, A family tree evaluation needs to be done with oncogenetics. Sometimes a small test in the blood or in the inside lining of the uterus can prevent developing uterine cancer in those particular women, though from those special families. So that's all today. If you have got more questions about uterine cancer, do not forget to write in the comment section. We'll try to answer that. Of course, this discussion was a very small nutshell of the whole uterine cancer, and there are more to it. If you are interested, we'll be happy to discuss in some other videos. Have a good day.